Now let us understand about the charge floor stock system. Charge floor stock system. Medicines which are stocked on the nursing station at all times and charged to the patient's account after they have been administered to them. So we have seen the free floor stock system in the first category, and in second category we are seeing the charge floor stock system where the patient has been charged for the medications. Okay? That is the difference. Each time when the patient is taking the medication, when the medication is administered by the nursing team, it will be charged to the patients and it will be charged to the patient's account. And the dispensing of floor stock drugs as, we can see the dispensing of floor stock drugs as 1. The patient is charged for every single dose administered to him. Now the patient is charged for every single dose administered to him. Selection of these drugs in various wards is decided by the Pharmacy and Therapeutic Committee. So now we are understanding about dispensing of floor stock drugs, how it is dispensed, the floor stock drugs in charged floor stock system. The patient is charged for every single dose which is administered to him. Second, the selection of these drugs in various wards is decided by the Pharmacy and Therapeutic Committee. Now the Pharmacy and Therapeutic Committee will act like a decision-making authority. They charge and the drugs, which drugs has to be kept and which drugs has to be selected in various wards. That will be decided by the Pharmacy and Therapeutic Committee. And lastly, once the floor stock list is prepared, it becomes the responsibility of the hospital pharmacist to make the drugs available at all times. Now, moving on to the table here, the pharmaceutical and related preparations based on the category, and here you can see the preparation. For anti-allergics, prednisolone tablet, antibiotics, penicillin G injection, anticoagulant, heparin, and cardiovascular drugs like digoxin injections. All these things and the preparations which has to be always should be ready and should be always whenever required, based upon the requirement, the drugs should be listed and it should be ready for the patient. What are all the drugs? These are some of the examples. There may be other drugs which are coming to the category. So they have to keep ready at all times. That should be made available in the hospital pharmacy.